Hi, I am Dr. Ruchi Malhotra. I am the Director of Fertile Solutions IVF and Research Center. Let's talk about certain conditions which cause infertility in females. We all have heard about polycystic ovaries. Polycystic ovary is a disease which involves an imbalance within the hormonal level because of the ovarian malfunction. In polycystic ovaries, the eggs are formed but they do not get mature enough so that the egg could be released at the time of ovulation and pregnancy can happen. So polycystic disease is basically a lifestyle disease. It is happening in a lot of women who are having urban lifestyle. Their sleep pattern has changed, their eating habits have changed, their physical activity has gone down. These girls as young as 13-14 years start suffering from polycystic ovaries, and it manifests as irregular menstruation during their youth, and also because of this there is a problem of infertility which has become very common amongst the youth, and it is a very common cause of infertility. So polycystic ovaries can be diagnosed by knowing the hormone levels by the blood tests, and then we can have a targeted approach and treat this condition so that the woman can get pregnant. There can be injections or there can be oral medications which can help such women to regularize their cycles and help them in getting pregnant. Polycystic ovaries is a disease which requires intervention so that a woman can get pregnant, because this disease does not allow the pregnancy to happen because it does not allow the eggs to mature and form a ova. Another common condition which is seen is endometriosis. Endometriosis is a disease in which the menstrual blood, instead of coming out from the uterine cavity, goes back within the tubes and within the ovaries, and it causes a lot of structural damage to the reproductive organs within the human body. So the tubes, initially the tubes will become a little inflamed, and gradually it totally distorts the relationship of the ovary with the tube, which never allows the healthy ovum to get into the tubes and does not allow the woman to get pregnant. Endometriosis can be diagnosed only by laparoscopy. Patient will have increasingly painful periods. She can have pain during intercourse, and sometimes this pain is unbearable. It can also form chocolate cysts, which is collection of chocolate colored blood within the ovaries, and they become very large in size, and this has to be treated laparoscopically. There is no other shortcut to this. There can be medical treatment, but that does not treat the chocolate cysts. They have to be surgically excised. So endometriosis, generally women land up in blocked tubes, which requires the help of IVF to get pregnant. There can be genital infection. Tuberculosis is a very common cause of infection which can give rise to inflammation of the tubes. The tubes become distorted, the tubes have got collection of fluid in them which is called as hydrosalpinx, and these tubes don't allow the pregnancy to happen. There can be also problem with the lining of the uterine cavity because of this infection. So this treatment of tuberculosis needs to be taken, and then only the person can think of getting pregnant. There can be some structural abnormalities within the uterus which can cause infertility. The uterine cavity may be malformed. It might have two cornu, or it can have a big septum, a thick septum, or there can be partial septum which does not allow the implantation to happen. So these, or there could be a fibroid within the uterine cavity which does not allow the pregnancy to stick through. Implantation does not occur and the woman cannot get pregnant. For all these, one needs to go through a hysteroscopy to analyze what is the problem, and by combining with laparoscopy, this problem can be treated partially or sometimes fully. So this can become a prerequisite to treat this, and then only the patient can get pregnant.